Welcome to the ReproNim course on Beyond the Numbers, where I will be talking about integrating mixed methods and community-engaged research with the ABCD dataset as a secondary dataset. I'm Marybel Gonzalez, and I'm an assistant professor and associate vice chair of community access and engagement in the Department of Psychiatry and Behavioral Health at The Ohio State University. Let's jump right in. As you know, the ABCD study dataset is considered a secondary quantitative dataset. When we talk about secondary data, this means that this is data that has been collected by other researchers with a focus on their research agenda. So they've had their own a priori research hypotheses and research questions for motivating the research study, and have designed essentially that study to meet those objectives of that research study. It so happens that with the ABCD dataset, we have the opportunity to expand on this as a secondary dataset because the ABCD protocol included so many questionnaires on development, including brain, cognition, substance use, environment, social factors, you name it. We have youth report, we have parent report. So we have an abundance of data in this data set. So when it's used as a secondary data set, this means that we can now take this publicly available data and ask our own research questions, which are secondary to the primary research questions that were originally posed as part of this research program. So now, most uses of the secondary data set for ABCD involve just using the ABCD data set to pose those questions, test your hypothesis, and base your interpretations on just your quantitative analysis alone. I will spend quite some time during this course talking about alternative methodologies to really start to incorporate social context and lived experience that may have been missed in the quantitative numbers. And these approaches include mixed methods and community-engaged research approaches. The learning objectives for this course will be to first identify key strengths and limitations of using large-scale secondary datasets like the ABCD study. Second, describe how mixed methods can enhance interpretation of secondary data. And three, to be able to recognize strategies for engaging communities to contextualize ABCD study findings. Now, let's talk about some of the strengths of using the secondary quantitative data set like the ABCD study. So the ABCD study, it happens to be a very large secondary quantitative data set. So there's a large sample size. We're following over 11,000 youth across 21 sites in the United States. This gives us greater statistical power to detect smaller effect sizes where other studies may be underpowered to be able to detect these smaller effect sizes, especially when it comes to development. As I mentioned earlier, we have hundreds of variables describing social contexts that include family, school, community, and other environments. So not only do we have parent report and youth report, we also have variables that are describing the social instructional environments of youth, and that data has come from external data sets that are also publicly available and have been linked back into the space of ABCD. And in conjunction with that, we have hundreds of developmental outcomes. So this makes our hypothesis space almost limitless. We're able to test a variety and combination of predictors with developmental outcomes to test our hypotheses. In addition, we have numerous demographic variables on a sample that has a pretty good representation of youth across the United States. And so this also gives us the ability to look at generalizability of some of these hypotheses. And then, of course, one of the biggest strengths of the ABCD study is that it's free. Now, given that one of the strengths of the ABCD study as a secondary quantitative data set is the number of variables in the data set itself, users really do have to think about the theoretical framework that they're using to be able to form their research questions and their hypotheses. In this paper published last year in the Journal of Developmental Cognitive Neuroscience, we articulated a model of adolescent development based on Bronfenbrenner's ecological systems theory. And in this paper, we were really interested in matching the ABCD protocol back onto the Bronfenbrenner's ecological systems theory of development. And so essentially, we were interested in knowing how many variables did we have at the individual level. In addition to that, how many variables did we have in the microsystem, which encompasses the family, the school, all of the immediate environments in which the youth lives and interacts. In addition to that, we then looked to see what then lived in the mesosystem, which includes all of the interactions, all of those relationships between youth and parents, youth and teachers, family dynamics, all those things that are happening in the space of interaction between all of those immediate environments that the youth spends a lot of time in. We then also looked to see what other variables we had in context of the broader community level variables, including things that are at the neighborhood level, but also at the societal level. And so we've concluded that the ABCD study had over 50 variables that could be mapped back onto this Bronfenbrenner's ecological systems framework, really describing how these multiple level of influences could come together to influence adolescent development. So, with that said, there's a lot of literature out there already supporting how do these multi-level factors influence youth development. And so even though we were able to come up with this theoretical model to be able to describe where most of these variables land when it comes to multi-level influences, we still found there was a quite substantial number of variables. So that still leaves us with the problem of which variable do we believe is influencing the outcome that we're trying to test. So some of the limitations of using the ABCD study as a secondary quantitative data set definitely revolve around selecting the variables that you want to include in your model. Given the extensive number of variables that are included in the model, it can sometimes feel like it's turning into a fishing expedition. You're trying to throw in so many variables into your model because you have the power to detect even small effect sizes. But then that also puts constraints on the types of conclusions that you can reach when you have conducted what is considered to be a more exploratory model. And so this is a limitation when there isn't a literature that is specifically going to be able to point you to the variables that you want to select for your model. Another limitation of a secondary data set is that you may be missing the context of engaging with participants. What I mean by that is that because it's secondary data, you have not had the opportunity, most likely as a user, to have participated in the data collection. You will be missing that firsthand experience of interacting with participants, of knowing what the research day was like. What did that interaction between the research assistant and the participant look like? And some of those qualitative things can sometimes be important when you think about the quality of the data and how the data was collected and what it means in terms of interpreting your data. So these are just a few of the limitations of using a secondary quantitative data set. Now let's talk about a few ways to tackle these limitations with secondary data sets surrounding that qualitative feel of what it was like to collect that primary data, and even how do you know which variables to include in your model. Mixed methods approach is a methodology that has been widely used in a lot of fields like sociology and public health. Creswell describes this as an approach to research in the social, behavioral, and health sciences, in which the investigator gathers both quantitative, which is close-ended, and qualitative, open-ended data, and then integrates the two and draws interpretations based on the combined strengths of both sets of data to understand research problems. So in essence, a mixed methodology involves collecting two different kinds of data, whether it's quantitative and qualitative or vice versa. Now, when you add in combination with mixed methodology a secondary data set, what this essentially means is that you are now using a secondary data set in combination with some other primary data collection. And those approaches are two different types of approaches. So one example would be using the ABCD study data as a secondary quantitative data set together with a primary qualitative data, which would have a small sample size. So you still are introducing two different types of data, quantitative and qualitative. The ABCD study one just happens to be a secondary quantitative data set. Now, this is a more novel approach to mixed methods. Traditionally, in mixed methods, you are considered to have collected both the quantitative and qualitative as primary data. So you are the person who is collecting both quantitative and qualitative data. But now, as a field, we're expanding to alternative ways to be able to apply mixed methods. And one of those ways is leveraging secondary data, given that there are so many data sets that are out there now and have been able to put that out as a resource. And so you can save time, you can save money, and you can leverage existing data as a secondary data set when you pair that with some kind of other primary data collection. And so that's what a mixed methods with secondary data model would look like. So I've talked quite a bit about quantitative data and qualitative data. So, for those who may not be familiar with this terminology, quantitative data refers to any kind of data that has been collected in the form of a questionnaire with multiple choice responses or some kind of a neurocognitive assessment where you take a test and you respond to questions. And then at the end of the day, you're basically getting numbers. You're getting numbers in some kind of tabulated form to be able to put them in some kind of statistical model to determine significance. And so that's, what we primarily have collected with the ABCD study is that quantitative data. Now, qualitative data is the opposite. In qualitative data, you tend to have smaller sample sizes, and this is data that is meant to capture literally the qualitative aspect of an interaction. So these look like conducting interviews or focus groups, and where you're asking participants open-ended questions. In fact, with qualitative data, you're not supposed to lead participants to a particular answer. You're supposed to just be able to guide them to have a discussion around the topic of interest that you have. And so if your topic of interest happens to be social media, then you would start to ask your participants open-ended questions around their habits for social media, what they think of social media, but keeping them relatively open-ended. So what this gives us with qualitative data is really in-depth, rich stories. And this is because we don't narrow down the responses that participants can give. So with quantitative data, they're usually asked to select from a subset of responses. But with qualitative data, we're talking about open-ended questions. So this means participants can just tell us whatever they're thinking. Now, in real time, this does translate to more time during data collection, because you have to allow for that discussion and the responses that are going to occur during this open-ended interaction. And also during the analysis phase, it does require more time and more resources to be able to analyze the text that is produced from this interview or focus group, and then derive meaning. So I will not focus in this course the methods of qualitative data, but I did want to spend at least one slide talking about what it is, what it looks like. And if you're interested in learning more about this, I'll provide some more resources at the end for citations and literature you can go and look at. All right, so why use a mixed method approach with secondary data analysis? As I mentioned earlier, there are lots of different ways in which we can start to think about using the ABCD data set in the mixed method approach, specifically with the ABCD data set serving as that secondary data set. Now, here I want to start to highlight the work of Dr. Daphne Watkins, who published a book in 2022. And in this book, she dedicates several chapters to describing this mixed method approach, specifically with secondary data. As I mentioned earlier, traditional mixed methods involves primary with primary data collection. And so this idea of leveraging existing secondary data sets in the mixed method approach is relatively new to our field, and it is an emerging idea. I encourage you to find Dr. Watkins' book and read up on it. It will give you lots of details, lots of information that I will not have time to cover in this course. The next few slides will be based largely on Dr. Watkins' work using this mixed methods approach with secondary data analysis. So now, Dr. Watkins makes several points about, why use a mixed method approach with secondary data. Using that secondary data set will save you time, money, and allow you to use an existing resource. But it also allows you to still be able to assess the depth of a topic, so that you're either going to get more information and learn how to proceed with your qualitative study, or be able to know how to proceed with your quantitative study. So in the next few slides, I'll describe different scenarios in which you're going to either first utilize the secondary data set to then inform the qualitative approach, or do the converse, where you're going to first do a qualitative study that's going to inform the variables that you're going to select in your quantitative analysis with the ABCD study. There are several different designs when it comes to mixed methods, but I think these are the top three that are most widely used. The first one is a convergent design, followed by an exploratory sequential design, and last followed by an explanatory sequential design. And I'm going to go into much more detail in the next few slides, but I wanted to give you this overview early on so you have the mindset of how many different approaches we're going to be talking about. And I'll show you this table again at the end for a summary. In a mixed method convergent design, you are essentially collecting and analyzing both your quantitative and qualitative data at the same time. So you're doing this in parallel concurrently. Now with the ABCD data, because it's already collected, you don't have to collect that data, but you would definitely want to wait to analyze the data until you've collected that qualitative data and can analyze that qualitative data together with the ABCD secondary quantitative data. So the purpose of doing a convergent design when you are looking at both quantitative and qualitative data at the same time is to see if the patterns and lived experiences converge. Do they align? You can also use this design to test whether there are places where they contradict each other. So you may have hypotheses about reaching convergence in the hypothesis that you've tested in your quantitative data with the hypothesis that you have in your qualitative data, but there are some cases where the findings may contradict each other. Here's a quick example of what this could look like with the ABCD data set if you're proposing a convergent design. So with your quantitative data in the ABCD data set, you would want to test whether higher levels of reported family conflict are associated with higher internalizing symptoms. So in other words, depression and anxiety in adolescents. With your qual, you would then conduct brief interviews with teens and parents, and you can ask questions like, what does conflict look like at home? How do conflicts affect their mood? How do you feel after a conflict occurs? And so you would gather all these open-ended responses to these questions, and then be ready to analyze both your qualitative data together with your quantitative data. Now, when it comes to the stages of comparing the findings and determining convergence, one idea here would be that with the quant, you're predicting that more family conflict is going to be related to more internalizing symptoms. And so then you would hope to see convergence in your qual data reflected in maybe teens describing feeling worried, sad, or withdrawn after arguments, and caregivers noting that this tension lingers, and that it affects their child's mood more. So with the qual data, you may not entirely see the same mapping of language, but you want to see a mirroring of that phenomenon explained in their own words. And so, with the quant data, we have internalizing symptoms, and with the qualitative data, we have participants describing that they're feeling worried or sad. So this is just one brief example, and there is a whole approach on how to be able to integrate both your quant and your qual data in a convergent design, and I do encourage you to read Dr. Walken's book for more information on considerations for analysis and taking a deep dive into those procedures. Now let's talk about the next mixed method design. This is an exploratory sequential mixed method design. In an exploratory sequential design, the qual is preceding the quant. So the qualitative study is happening first. You're conducting those focus groups and those interviews, asking those open-ended questions first, and then you are using what you learn from the qualitative data to inform your quantitative models. So this can look like using themes that you identify in your qualitative study to guide the selection of variables in the ABCD study analysis that you're going to conduct. The purpose of using the exploratory sequential design is usually to be able to discover variables that should be selected based on the importance to participants, based on the saliency to participants, based on that first-hand lived experience responses of what they think is either a problem or a solution to their particular health area that you're asking them about. This is typically a good approach when there's less pre-existing literature on the topic. So you're going to be conducting this very much more exploratory type design in cases where there isn't a lot of literature on the topic. And this kind of design is really going to help you answer the what, because the qual, it may help you identify what are the things we should be focusing on? What are the things youth care about? What are the things that you think are important when it comes to this particular topic? And then you want to be able to use what you learned from the qual to then inform your selection of variables in the quant. And so here's a brief example of what that could look like with an ABCD data analysis. So for instance, say there's not a lot of research on how teens describe sleep problems and whether they connect their sleep problems to neighborhood factors. So notice this is specific research on how teens themselves describe sleep problems. So I think there's tons of research on sleep and teens, but we're assuming here that maybe there is a literature gap on how teens perceive their own sleep problems. How do they describe their sleep problems? How do they talk about their sleep problems, right? And this comes back to that disconnect between science and communities, which I'll start to talk a little bit more in a few slides ahead. The language that communities use to describe their health problems or their health solutions, it's not the language that we use as scientists. And so that is one interesting thing to pay attention to, and that the labels that we put on phenomena may not necessarily be the way people describe that phenomena, even though we're talking about the same thing. And so sometimes labels have a funny way of assigning meaning, even when we don't intend it. So it's just important to start to think about that and note that. So back to our example here, we're talking about how do teens describe their sleep problems, and do they even connect these sleep problems to neighborhood factors? So you would first conduct a qualitative study where you ask questions about their sleep. Teens have the opportunity to just answer these authentically, and you could ask things like, what makes it hard for you to fall asleep where you live? And you're not leading, you're not putting ideas in their head, you're not saying, what about the noise, or what about this, what about that? You're just letting them tell you. What this then gives us is data from which we can analyze and draw themes. So what are the themes that we're seeing in this qualitative data? And those themes can then be used to identify be matched back to ABCD sleep measures and also neighborhood variables that approximate those experiences. And so now our model has been informed by this very much more qualitative lived experience data. And so we're doing this in situations where we have less literature, or we think we're testing something new or something different or discovering something novel, hence why it's an exploratory sequential design. Now, the last method I want to talk about when it comes to mixed methods designs is the explanatory sequential design. I think that this explanatory sequential design is probably one that can be easily implemented with the ABCD study. And what it would look like is you basically conduct your quantitative analysis with the ABCD study based on existing literature, some kind of theory, or research framework that you've identified, and that it's supporting the hypothesis that you've formulated. And you could go ahead and you test your hypothesis, and you identify patterns, you look at trajectories, you test associations, you determine significance. And so you get that first layer of interpretation that we normally do with ABCD data at the quantitative level. The next step that would differentiate this study from a single method study is that we're going to now conduct a qualitative study. We're going to follow up on that quantitative analysis with a qualitative study that then will help us explain or contextualize or deepen our understanding of those ABCD findings. This can be particularly useful when you get quantitative findings that are not exactly telling the story that you anticipated, or maybe you're finding some association, but it feels incomplete, and you're thinking about modifiable factors, you're thinking about intervention, you're thinking about treatment or prevention, and the factors that you've tested hint at a pattern, hint at an association, but you can't quite make those recommendations on what would be the modifiable factor. And so this is where a qualitative study could be very useful, because now you're in the ballpark with your quantitative data of some association, and then the qual is going to allow you to dig deeper to really find that context and deepen that understanding. So an explanatory design is really helping you answer the what, why, when, and how. As I mentioned, it's very useful when there's been a lot of literature and it's been put out there, and you're using your theory and your research framework, but you find associations that make you pause and make you think, is this the right interpretation? So here in this example with an explanatory sequential design, again, you're doing your quant first and then your qual. you would basically look at your ABCD study results, where you see a strong association between neighborhood adversity and sleep. So you have some kind of model that's telling you that greater neighborhood adversity is associated with poorer sleep. Now, you're wondering, well, what is it about that neighborhood adversity? I know that some of the neighborhood questions in our ABCD study really get at more deprivation. They may be much more higher level. If you're going to have to make a recommendation of what you change in the neighborhood to improve sleep, it may get a little bit harder to identify that concrete modifiable factor. So then what you can do is follow that analysis up with a qualitative study where you interview adolescents. Yes, this is going to be a much smaller sample than your ABCD sample. You are going to have to think carefully about which participants you want to have represented in your qualitative study. They're probably not going to come from the actual ABCD study space, but you can leverage, again, all that data in the ABCD study to really find out who is your at-risk population, who is your population of interest, what types of neighborhoods do you think are most influencing the sleep phenomena. And so then what you do is in your qualitative study, you design a recruitment plan to be able to enroll participants that match those that are representative of those ABCD demographic characteristics. So once you've done this ABCD data analysis, you've now conducted your qualitative study, and you've started to ask your youth in this qualitative study questions around, what is it that about your neighborhood that is hard for you to fall asleep? Is there anything that is difficult for you to fall asleep, that makes it more difficult for you to fall asleep at night? And so then this would answer the why. So maybe this is where youth start to tell us it's actually about the noise, or I'm worried about safety, or I don't have a routine, or I just feel stressed, or they may just identify other things that happen to be correlated with neighborhood characteristics, but in fact may not be characteristics of the neighborhood themselves. So this is just, another step for you to be able to take that meaning, that interpretation that you have derived from your quantitative data, and then take it one step further, conduct this qualitative study, and fill in the why. Okay, so just to recap, I went over 3 different mixed methods approaches in a convergent design, an exploratory sequential design, and an explanatory sequential design. I know it's probably a lot if it's your first time taking a deep dive into this mixed method approach. But again, I do encourage you to find Dr. Watkins's book and take some time to really read through those methods. And there's tons of other work that has been done in the space of mixed methodology, particularly the work of Cresswell. And I will go ahead and provide citations for further reading at the end of this presentation. So just a few more notes here to highlight. It's really important for the user of the ABCD data set to know the role of the secondary data, especially if you're thinking about a mixed method approach. It's important to know the role of your secondary data because that will definitely determine what type of design you're going to choose. If you're choosing an explanatory design, you're going to prioritize those quantitative findings, those findings from the ABCD study. Your theory is going to guide the selection of variables, and then you're using the qualitative to discover something new, something that may have been missed in the quantitative data. In an exploratory design, you're prioritizing the qualitative data. And so then the goal of the mixed method is now to develop, a conceptual framework to essentially figure out what are the variables that need to be tested, and then you do that in a quantitative space with the ABCD data set. In our paper published recently in Frontiers in Public Health, we describe our application of a mixed methods convergent design using the ABCD study as a secondary data set. And so here we have figure 2, where we describe our overall approach, which was really a community engaged research design, and I'll talk a little bit about what that looks like in the next couple slides. But leading with the community engaged research design to then apply a mixed methods convergent design. We used the secondary data from ABCD to propose our models and our hypothesis testing surrounding how neighborhood factors influence substance use among adolescents. And we simultaneously conducted a qualitative study, which a much smaller sample of youth in a neighborhood that matched the sample characteristics of the at-risk group we were interested in studying, and we used the Childhood Opportunity Index to identify those neighborhoods. And so in this much smaller sample with the qualitative study, we were able to ask questions of youth about their neighborhood experiences and what were some of the positive things and some of the negative things in their neighborhood. Really, having it be a natural discussion. These were interviews that were done one-on-one with youth, and having it be a natural discussion on their perspective, their perception of their neighborhood, and how their neighborhood influences their health outcomes. We are now in the data integration phase of this project, and so in this paper we describe our protocol, and we go into details about our hypotheses and our selection of variables, and recruitment and partnership with our community partner in order to collect that qualitative data. And we also describe, next steps for the data integration phase and then the proposed dissemination of findings. So one of the most important things that supported our mixed method approach with secondary data in the ABCD study was our community partnership. So we spent quite some time developing a relationship with the local nonprofit that also had a platform around adolescent health and promoting adolescent health. And we were able to build and establish a relationship, which in turn helped us really understand the population we wanted to recruit, how to recruit the population we were interested in, and then also informed some of the critical decisions in our qualitative study, which was how to approach asking youth about their neighborhood conditions, particularly in the context of substance use. And so this ended up being really critical information that we were able to apply in real time to our design. We were also able to use the expertise of our community partner in an advisory panel, and we were able to get information in real time about our model design, our selection of variables in the ABCD study, and some of their initial feedback was also important in how we were thinking, conceptualizing potential designs and then future interpretations of these studies. Now, I wanted to highlight, the importance of having a partnership like this when moving into an approach like mixed methods design, and to start to incorporate community engaged research approaches. And that's really because the community is the expert. They are the expert in their lived experience, the expert in the context that they experience. And for that, it's important to be able to think about, how am I going to include this in my research process from the start? I think that it's, one of those things that you may not realize it's important to have in your project until you're reaching the interpretation stage and you're like, geez, I wish I had someone who had lived experience to really talk to me about what this means in my data, what this could possibly be a proxy to. And usually that creates, model in which we're not able to really get efficient and productive feedback from community members. It does take time. It's an investment to build a relationship with a community partner. You want to include them in the planning stages of funding if you're thinking about getting funding to do the project that you want to do, and you also want to include them in your budget. They have expertise to contribute and time to contribute, and so they do need to be compensated, just as how you would compensate any consultant for scientific expertise on your grant. And so in the same paper, we talk about planning, and how the importance of planning accordingly, and we take some time to really describe the timeline for which we were able to include early planning with our community partner in these stages of the initial development of the grant application. So before we even put in our grant, we had started to talk to our community partner, establish a relationship, get initial feedback, maybe not as in-depth as we wanted or needed to, but at least we were able to lay down those fundamental steps that were going to be really important for us to be able to set up a study that would include, that would have a space for them on our project. And so you can see that most of the time when you apply for funding, it's like a 1-year cycle. Prior to that 1 year waiting period, whether we would get awarded, we had a 3-month runway of building this relationship with our community partner, and then the particular award that funded this mixed method study with the ABCD data was a 2-year award. And so here, I go into more details about that timeline of when and how we elicited feedback from our community partners. So I encourage you to read the paper here published in Public Health, and get some more details on the protocol and how we chose our design. In summary, the application of a mixed methods design with a secondary data set can add context and meaning behind your quantitative patterns. It can also help you identify measurement gaps and improve model selection. It can help you interpret unexpected or ambiguous findings from your quantitative data. It can also strengthen the potential for impact to identify modifiable factors, especially if in your quantitative phase, your variables are not very specific, and then the qual can help you fill in those specifics. And in the end, integrating methods can support a more robust and credible conclusion. And so by definitely incorporating a qual with a quant, you're expanding that discovery space. And lastly, I wanted to emphasize the importance of incorporating community-engaged research approaches when you are applying a mixed method design. I hope you were able to get that from the previous slides, but really, community-engaged research approaches is a commitment to including and representing the voices of the communities that you're studying. And so in doing so and in leading with that, with those ideas, you're going to get a much richer and deeper understanding of the phenomena that you're trying to study. But at the same time, mixed methods is difficult. It's hard. You're going to be asked to do, go above and beyond what you would have normally have just proposed in your secondary data analysis. And so doing that approach in partnership with a community partner can really facilitate, and they can give you access when there may be challenges or barriers in recruitment, if your team is not well versed with the neighborhood, or well versed with the population. It really helps to not just really understand the population that you're studying, but also to be able to come in with a trusted partner. So that's all for today. Stay tuned for the next slide, where I will give you lots of references And feel free to reach out if you have any questions. Thank you.